everyone, and welcome to our Reproductive Rights Town Hall. My name is Ani Mehta, and it's a pleasure to be your moderator tonight. I'm a junior in CLAS studying health policy, and I'm the Title IX Advocacy Coordinator and a Multicultural and Diversity Senator in our Undergraduate Student Government, more commonly known as USG. Organized by USG, the aim of this town hall is to educate you on what reproductive healthcare resources are available on campus and locally, the impact of the Dobb's decision, where the Supreme Court overturned Roe, and how you can be an advocate for reproductive justice. We will begin tonight's event by a discussion by our panelists, who will introduce themselves shortly. Following, there will be a Q&A session. Please submit your questions by scanning the QR code, which can be found on the second page of your pamphlet, or in a little bit, we'll project it on the screen behind me. And feel free to send in questions throughout tonight's event. But because the topic of reproductive rights has been one of controversy, especially over the past few months, this is the only channel through which questions will be asked. If you have a UConn email, please include it, and if not, any email will do. These pamphlets also include more information about about your rights and how to access resources. It's important to remember that reproductive injustice is a pressing issue that will impact marginalized communities more than anyone. Women of color, specifically Black women, LGBTQ folks, and low-income individuals will be the most impacted by the current political agendas aiming to remove access to reproductive health care. USG wants to extend our services to these communities, of which many of us identify with ourselves, and we encourage all of you to join us in our advocacy projects. We also want to emphasize that USG distributes sexual health resources and refers students to services provided by Shaw, the Women's Center, and off-campus facilities. We strive to build a stronger coalition of students that are informed on reproductive rights and are capable of sharing this important knowledge with one another. I'd also like to thank my colleagues for the incredible work that they've put into this event, including Karen Lau, Sydney Collins, and many others. Before we begin the town hall, I'd like to remind everyone that the emergency exits are located at the back of the room and the front left and right sides of the building. I will now read a land acknowledgement provided by the Native American and Indigenous Students Association. We would like to begin by acknowledging that the land on which we gather is the territory of the Mohegan, Mashantucket Pequot, Eastern Pequot, Scotiagook, Golden Hill Pagusset, Nipmuc, and Lenape peoples, who have stewarded this land throughout the generations. We thank them for their strength and resilience in protecting this land and aspire to uphold our responsibilities according to their example. I'd like to invite our panelists to introduce themselves now. Maybe we can start with Dr. Delaney and go down.
Hello. Okay. Hi everyone, I'm Kara Delaney. I'm an assistant professor in the OBGYN department at UConn Health. I also completed a fellowship in complex family planning, which means that I'm an OBGYN, but I also spent a couple of years just focused on abortion care, miscarriage care, and also complex contraception.
Hi, so nice to see you all. I'm Molly Brewer. I'm chair of OBGYN at UConn Health, and I'm actually an oncologist. I'm a gynecologic oncologist, which means I take care of women with gynecologic cancers, but I'm a firm believer in reproductive health care for women. And so that's really, so we were fortunate enough to hire Kara last year because she's really developing some of the liaison with some of the other providers in the area. So.
Sounds like it's on. Hi everyone, I'm Kathleen Holgerson. I use she, her pronouns. I'm the director of the Women's Center. I'm also a two-time UConn alum, and I actually volunteered at the Women's Center back in the day when I was here as an undergrad, so I have a couple different perspectives on this conversation.
Hello, welcome. I'm Suzanne Honorado, the Executive Director of Student Health and Wellness here at UConn. And for those who don't know, student health and wellness includes medical care,
pharmacy care, mental health, and health promotion, and we offer a full array of services that we're really excited to let you know about if you don't already know.
Hello everyone, I'm Tina McCarthy. I'm the Director of Nursing at Student Health and Wellness. And I've been here for about 16 years, but I'm also an alum, so I share Kathleen's dual perspective when it comes to being here as a student, which was a long time ago, but it's near and dear to my heart, and as an employee as well as a community member.
And I'm Elisa Aram, the Medical Director at Student Health and Wellness, and I have the privilege of working with Tina and Suzanne and our partners at the Women's Center and our community partners as well. So we're glad to be here.
Awesome, so we'll start right with the questions. So our first question is, what sexual and reproductive healthcare resources are offered at UConn and UConn Health, and how can students access these? And in addition, are there any barriers to these resources that students should be aware of?
So I can start. So we are actually both based out of the Farmington campus, and that is where most of our reproductive health services are, which is granted a little bit far away. So we're talking about some access issues. We can jump right there in terms of transportation and other things like that. But we provide all services in terms of contraception, abortion care up to the state limit of providing abortions, which is 23 weeks and 6 days. We also provide medication abortions, surgical abortions, both in clinic and in the operating room setting. And we also provide all reproductive health services, so that includes opportunities for adoption services, and then also for full pregnancy care too. And we have a couple of other campuses, a couple of other clinics too that provide this care. The closest one we do have a provider here at Stores that does full contraceptive care.
And then here at Student Health and Wellness, we're located in the Hilda May Williams building, which is right on Glenbrook, and most students know the chemistry building, so right behind there, so very convenient from a location perspective. As I said before, we offer a full array of sexual and reproductive health services, including gender-inclusive, preventive, gynecological care, sexually transmitted infection screenings and testing, which includes expedited partner therapy. We also have sexual and intimate partner violence services, including the SAFE program, which is sexual assault forensic evidence. And we are the only location in Connecticut that is not an emergency room. So we work very closely with our partners on campus to ensure choice for students who might want to use that service. But either way, we have a supportive sexual assault response team. We also do contraceptive care, including emergency contraceptive, and starting last year, we partnered with USG to provide Plan B, which is available at no cost to undergraduate students through the UConn Shaw Pharmacy, which is also located in the Hilda May Williams building. So come on in, and many students have already taken great advantage of that opportunity. And then through our health promotion department with Student Health and Wellness, we offer Glove Box, which is an online ordering free delivery service for students who want safer sex supplies, including free condoms. So you go online, you order the box. If you live on campus, it goes right to your campus mailbox. If you live off campus, we have convenient locations for you to pick that up. We offer education about sexual health, including our peer education program, so your colleagues called the Sexperts, and they're available to do programming for your organizations or your group as you need it. We have free menstrual products at the Hilda May Williams building, and we also have 24/7 nurse advice for anyone who has any questions about any medical issue or concern, but of course including sexual and reproductive health. In terms of access, these services are available to all students who are matriculated at UConn on the STORES campus. So there shouldn't really be access problems. You would call to make an appointment. We do offer one service called Get Yourself Tested, which is a sexually transmitted infection screening program, which you can actually book online. So we have some online opportunities for scheduling. And then most of these services are offered throughout the full year. There are a few that are only offered while school is in session, so you can check our website for kind of what's available and what's not, depending on when you need to access our services. Did I miss anything? And we are a confidential service, so our services are private and confidential, as is true of all medical care.
Great. So Women's Center does not actually offer the same sort of direct services that you've heard of from my colleagues, and I actually want to take this opportunity to kind of clarify that a little bit, because interestingly, our phone number is two numbers transposed from the Women's Clinic, so we very often get calls at the Women's Center starting with, I have questions about okay, well then let's get you to the right place. But we do, similar to what Suzanne has indicated through our partnerships with USG and through Shaw, we are a location on campus where you can get free period products. We also are a place where you can get free safer sex supplies. And so just wanting to let folks know that we are more of an information source than we are necessarily a direct service source. But one of the roles that we do play, speaking of confidentiality, as it relates to our reporting policy on harassment, discrimination, and relationship violence, the staff at the Women's Center and at the other cultural centers and programs are all exempt from reporting. And so what that does is it often creates space for folks who are struggling with what's happened or trying to think about what their options might be, to be able to talk it through with somebody before anything gets triggered at the institutional level. And so we know that there can be all kinds of sexual and reproductive kinds of consequences to gender-based violence, and so wanting folks to know that there is this exempt resource on campus. In terms of the barriers, one of the things that I would offer for us to maybe think a little bit about, I know we've been having conversations with the students at the Women's Center recently about just access to information and how folks get information. And so a lot of times we have a tremendous amount of resources on campus and at Farmington, as you've heard from our colleagues, but often folks don't know until they need to know, and when they need to know, they're sometimes in crisis or kind of not clear on how best to access information. And so I think part of what I would offer as us a community to think about is how are we making these issues important to people before they need to know, in a way that the information about all these resources really resonates for them.
Awesome, thank you. So my next question is, many students find it difficult to navigate the policies when it comes to insurance and billing of Shaw, UConn Health, and outside organizations. What advice do you have for students?
So at Student Health and Wellness, many of our services that we listed above are included in the fee bill. So you can come in and access our services based on having had paid the wellness fee. However, we do have certain services that we bill your insurance, and insurance is required for all students to have. You're required to have insurance coverage, so it's just a great way to have insurance companies pay for some of our medical care, as it helps to kind of keep the fee bill at a certain rate. In terms of some of the ways in which insurance works, some insurances are more comprehensive than others. So we at Shaw have a philosophy that we do not want financial barriers to get in your way of getting care. So if you do find that your insurance is not comprehensive to cover services, let us know, and we have experts available to kind of help you navigate that, and we have ways in which to support your care in all different ways. We can kind of work through that. And then lastly, we do have insurance specialists on our team at Shaw, and they're always available to answer particular questions related to your insurance plan, and certainly what's covered in your fee and what isn't.
answer on behalf of what we've about what services we could do through UConn Health. Basically, we take all insurance, but there is some programs available for people that are self-pay, and we also have really great financial counselors too that try as much as possible, kind of like what happens at Shaw, to really provide services that are needed for all patients. That is done on an individual basis. In terms of other reproductive health services, you guys received a pamphlet, I think, about different organizations and clinics in the area. So like Planned Parenthood, like the Hartford Guidance Center. And so these are all places where they can also provide care, but also have some outside sources of funding to help with not only like the services that they provide, but also transportation, childcare, other things like that, that basically provides avenues for people that have financial issues or other access issues would be able to get care. So a lot of times those outpatient clinics have grants and other funding options that sometimes like UConn Health as a larger institution doesn't necessarily have.
And I also just wanted to add that the SAFE program that we have the Memorandum of Understanding and Agreement with is something that is of no cost to you. So those are ways that we reduce barriers for students to seek care when they're survivors of sexual assault.
Awesome, thanks. I didn't know that there was like experts to help navigate the whole insurance, so that's awesome. Next question is, what are some of the biggest challenges that your organizations are facing right now with respect to reproductive health care? And how do you anticipate to overcome these challenges to improve services for students?
I'm just going to reiterate what Kathleen said. I think one of our biggest challenges is just letting students know, like, we feel like we're out there all of the time promoting, advertising, letting kind of students know what's available. But then at that moment, when students need it, they often don't know what is available. So for us, we love partnering with USG and other organizations to really educate everyone, but certainly even if you could be a good friend and have this information available, it's really a huge barrier to all the ways in which there are services available locally and throughout campus to really support our student needs. I would also say there's a lot of confusion right now also about what's happening nationally and how that relates to Connecticut state law in terms of the changes to women's rights and access to services. So I think we have some work to do to just kind of allow students to be more fully informed about their choices and what the law allows.
I'd also just like to add that in the spirit of us having an advice nurse available to all of our students, we want for any individual to know that they can ask these kinds of questions. So we often have partners or others who call on behalf of their loved one or someone that they're concerned about. And these are ways that we also decrease barriers to access, right? So if you're looking to help that friend, feel free to give us a call.
And just to reiterate, we really are committed to the health and wellness of our students. It's something we feel very passionate about, and if there is a question you're not sure where to go, calling us is never the wrong choice.
I also think that avenues like this town hall and really listening to you guys is super important because we are also not in your shoes, and we want to make sure that when we're thinking about creating new services and new partnerships too, that we really consider the people that it's going to affect the most, which is you guys. So please, like during or after this town hall, we really want to hear from all of you.
work is a little bit more in the advocacy and the education realm, and so I want to talk a little bit about some of the challenges, which I think are connected to some of what my colleagues have already offered. We've been having some really interesting conversations with students about the lack of information that they have about what to expect in terms of their care. And so thinking about how are we proactively giving folks information about what to expect from your OBGYN visits or anything else that you might be accessing. And I think there's sort of a layer of silence and discomfort around those conversations. And so our programming committee has actually been doing, I think it's actually tomorrow night, is doing sort of an informational session. We've done that a couple times now. And it's interesting because, so we also work with staff and faculty, and I know this seems very, very far away for you all, but as Tina was saying, we were students here once too, and probably didn't think we'd be here however many years later that we are. But we interestingly over the summer had a conversation with some staff and faculty where we read the book, What Fresh Hell Is This?, which talked about menopause, and I know that that's something that again feels really far away for a lot of folks, but what's interesting about sort of all the ends of that spectrum conversation is again feeling like folks did not have good information about something that impacted so many people, and why did we just not know what we should have known? And so again, I think that's why the education piece is so important, so folks do know what to expect and are able to navigate those conversations with the professionals. Because again, I would assume that the more informed you are, the more that those conversations can be productive conversations. So I think there's that piece of it. The other piece is that, having been here for a while, we've talked up until this past summer, we've been talking about how the student organizing seemed to be really quiet around reproductive justice. And then all of a sudden, the SCOTUS decision hit, right? And it's like, oh my gosh, how could this happen? And for some folks, they've never known anything but a world where Roe existed, right? And for some people, really surprised by this decision. And for some of us, it actually wasn't so much of a surprise. I mean, there's been a lot of consistent organizing that has been happening over a tremendous amount of time that was going to lead to this. And so I think that speaks a little bit to our privileges sometimes, right? When we are so used to having access to something, we're suddenly so surprised when that gets taken away, right? But for folks that have often already been navigating barriers and ways in which their care has been curtailed, maybe not so much of a surprise. So the last thing that I would offer is I think as we're having this conversation about reproductive rights and reproductive justice, making sure that we are expanding the conversation to really talking about all of the ways in which these are challenges on bodily autonomy, right? And that manifests very differently for different people in different ways based on identity, but all of these things are connected and we should be talking about all of them.
So I just want to make a quick comment about those of us at UConn Health really want to hear from the students. What do you need? What's lacking? How can we help? We're working with Student Health Services. We've kind of started a collaboration. So we want to know what you all need. And if we don't get that feedback, then we don't know what's lacking.
Awesome. I'd just like to invite Senator May Flexer to introduce yourself. Thanks for joining us.
It's on. Good evening, everyone. My name is May Flexer. I'm the state senator here at UConn, and I'm really pleased to be here to be a part of this conversation, and I appreciate you welcoming me a few minutes late. We have a big district to cover, so I appreciate that indulgence. And I'm excited to be a part of this panel and to hear the concerns this evening. I know that some of the other panelists have said this, but it's hard to put into words what a scary time this is. And I'm glad that you're all here this evening. And my number one job is to make sure that the people in our district, including all of the students on this campus, have the right to make their own medical decisions.
Awesome, thank you. So going into our fourth question, what is the current relationship between the UConn Women's Center, the UConn Health, and Shaw, and how could we further these connections to improve services for students?
So I'll start. So UConn students should start first with student health and wellness, and then we're a great hub for getting you access to what you need. And as Dr. Brewer said, we've been working very closely on creating a partnership, but we already do provide access to resources at UConn Health when we're not able to provide them. So we already have a lot of those connections and partnerships in place. But we now recognize that there's so much more we can do given ways in which the landscape is changing. So it's a great way. Your fee, kind of is part of having access to our services. And then we also partner with all of the cultural centers, including the Women's Center, to really get a sense of what our students need. And of course, we're constantly in touch with our students. We're out on campus, and we're really getting information about how we can create more services, change our services, work in partnership to meet the needs of our students as we're hearing about it from our partners, and then work with UConn Health and other services that UConn Health might not provide, although they're very comprehensive, to really create that referral source to make it easy and to get transportation that you need to those services. So I just feel like UConn students have these great services that are interconnected, and in some ways, hopefully wherever you start, you get to what you need, because we're all working in partnership to meet the needs of our students.
Two things. One, I think what happened over the summer is actually a great example of the relationships. And so when USG had reached out and said, hey, we want to do this, and hey, we're concerned about what's going on in the world around us right now, we got together in a virtual room, right? It was about getting together the key stakeholders, like, hey, you reached out here, and I know this person, and we've been talking about this, and so really building that web of relationships and that network, and then leveraging it to have everybody's best thinking around the table. So I think that was really important, and I think oftentimes we miss opportunities to have students and staff and faculty and administrators actually in a room together, around a table, right? And so I think that's one thing that we could potentially think about doing. I had also mentioned to my colleagues actually right before this, so we've been talking about bringing together a group of stakeholders sort of in that same vein to talk about some of the what-ifs. If you look at any of the articles that are coming out in the Chronicle of Higher Ed or Inside Higher Ed, they're really talking about the best practices being no matter where your institution is located, whether it's in what's considered progressive or what's considered restrictive, that you need to get folks around the table to kind of think through what are all of the what-ifs to make sure that you have all the folks whose areas might be touched, but also to provide your employees and your students with pretty clear guidance about what to expect. And so we're going to be working on convening a group of those stakeholders to kind of do some of those tabletop exercises.
Okay, just a quick question. Is the QR code not working for people?
It's through a Discord.
Oh, okay, cool. I'll be sure to get a new one out to you guys. I'm going to try and project it up on the screen. Okay, but now we're going to move into kind of more of the reproductive rights and advocacy side of things. So how does UConn ensure reproductive justice for marginalized groups on campus? So for example, what are we doing for Black women specifically? And what are we doing for all menstruating students, not just cisgender women?
So at Student Health and Wellness about 2 years ago, we created the Health Equity and Access to Care office within Student Health and Wellness. So Ron McLean, Dr. McLean is our director, and we've been doing a lot of work to understand the unique needs of different populations of students as it relates to health equity and access to care. And reproductive health and access to care is a health equity issue. So we want to understand how different aspects of healthcare and healthcare law affect different populations of students and how we can best serve the needs of those students. In addition, we've been doing a lot of training around cultural competency and cultural humility so that our services are found to be supportive of students who come in our doors, all students.
So piggybacking on what Suzanne has talked about, I think our language is really, really important, and often doing our own education. I cannot tell you how many times, and I know this comes from a really good place, that folks are looking to do drives for period products. And I cannot tell you how many times the sign says feminine hygiene products, right? And so right off the bat, we're saying who this applies to and who it doesn't. And so I think spending the time to be able to think through, as we're doing things with good intention, are we being as inclusive as we can? That maybe some of the language that we were used to before is just not the language that we should be comfortable with anymore. And so I think that's one really kind of quick, easy, but important way that we can signal that we are trying to be more inclusive and that we're not just centering the experiences of cis women on our campuses. I think also, again, so much of the conversation, and not that this isn't super important, but so much of the conversation has been on the overturning of Roe as it relates to abortion care, and not really necessarily making the connection to all of the anti-trans legislation that's happening. So anything that has to do with curtailing gender-affirming care is really in the same vein of saying somebody else should control what happens with your body. And so, again, I think we just need to be a little bit more fluent in making those connections so that we are really saying to the community that we are trying to be mindful of all of the various ways in the way this manifests. You know, similarly, as we're talking again about abortion care, how are we thinking about maternal health support, right? And so if we really are about making sure that folks have access to a full range of choices and have access to, again, bodily autonomy, how are we making sure that everybody gets the care they need, no matter what the care services are that they are trying to access? And so I think all of those things are just about us doing our education to be able to be more fluent in those conversations.
And one other thing about the language too is that when we're talking about reproductive justice, that is an umbrella for reproductive rights, for abortion care, for infertility care, for people who just want to live in safe communities. And so the basis of creating the language around a more inclusive basis is very important to us as a department too, and something that we obviously need to work on since we're at UConn Health Women's Center. So this is something that we are have acknowledged as I mentioned before, as a large institution, things move slow in terms of change. But I think that also thinking about these next steps in a broader fashion, to not only really focus on abortion access, but also consider all these other really important aspects of how people want to live their lives and how people want to live their reproductive lives is extremely important, and what we as the department and what I think I'm hearing from the rest of the panelists really want to focus on in terms of next steps and how we can best make some really positive changes.
Yeah, I think that's really important. So this next question might be, I don't know if Senator Flexer has any expertise on this, but many students right now are comfortable with the state of reproductive rights in Connecticut, as Governor Ned Lamont declared CT a safe haven for abortion. However, this is not the case for everyone. How do we advocate for others who are not afforded these protections? seen a lot of people are comfortable. They kind of feel like, oh, well, it's not going to affect me specifically.
Okay, thank you for that clarification. So, to look at the glass half full, we can have gratitude that here in Connecticut for decades we have had leadership from people like our U.S. Senator Richard Blumenthal and our Congressman Joe Courtney, who led the way in Connecticut having one of the strongest abortion rights laws in the country. And that law is still on the books, despite what happened this summer with the Supreme Court Dobb's decision. But that Dobb's decision makes it clear that each individual state, and therefore state legislatures and governors, can take away those rights at any time. And so that's why people can't be comfortable anymore. In Connecticut, we used to have the double protection of the Supreme Court decision and the law on the books here in the state of Connecticut. Now all we have is that law. And so it really matters who the state senators are and who the state representatives are. Now here at this university in our district, and I'm happy to talk a little bit about the work that I've done in the area of reproductive rights as your state senator. Representative Greg Haddad is also here this evening. He's my partner in representing Mansfield and the university at the state capitol. And we're strong advocates for making sure Connecticut is at the forefront of protecting abortion rights. But make no mistake, if you care about these issues, then every 2 years when the decision is made for who our state senators and state representatives are, and every 4 years when we decide who our governor is, this decision is potentially up for grabs. I serve in the state senate where there are people who would like to outlaw abortion in Connecticut, and they could very easily gain a majority. I once served in the state senate just 4 years ago that was tied. So things can change very rapidly. In 2016, and I'm sorry if I'm going to get too political, but I am the politician on the panel. In 2016, when Donald Trump became president, many of us knew that what happened in June was the path we were going down. And I led a group of bipartisan, to be fair, legislators in making sure Connecticut had some even stronger laws on the books to make sure the protections around abortion access and contraception access and reproductive rights, that the federal laws that were on the books, in case they went away, that they were codified here in Connecticut. This year, Connecticut led the way. We led the country in having the strongest abortion laws to both expand access in terms of who can provide an abortion, so that it's not just doctors that are the only providers, but APRNs can now provide abortions, because right here in northeastern Connecticut, we have some real challenges with access to reproductive health care, to abortion specifically. And that's true across our state. And we also led the country in making sure that people from states, the 13 states where rights have been taken away by state senators, state representatives, and governors, where that has happened to people, that they can come here and be safe from retribution, and that the medical providers who provide that needed health care can be safe. We can't feel like, we have to be ever vigilant, is my message, because things can change very quickly. Another thing I initiated this year was a constitutional amendment for our state's constitution to protect the right to an abortion and the right to all reproductive health care in our state's constitution. I'm hopeful that's a conversation we'll be able to have moving forward, so that Connecticut could go back to being a place where you had that double protection. You had a protection of the law, and you have a protection of a constitutional nature, so that we can have some security again. But it's a long road ahead of us, and this is certainly a really scary time.
I appreciate that. I think you can't be confident that it will continue. I mean, what a lot of these states are talking about is a world where women can't get birth control. They're talking about if a woman has what we call an ectopic pregnancy, which is a pregnancy in a tube, that they would let her die before we would be able to take her to the operating room and save her life. They're talking about outlawing IVF and some of the reproductive capacity that we have if we have trouble getting pregnant. These are some of the things that are really coming down the road in some of these states. And I think, as students, actually do something, because you're our future. And if you guys don't do something to protect, really it's protecting all people, but particularly I protect women. And so I think it's just incredibly important that we all do our part, because this will be a very different world if some of these things happen.
To continue with the direness, so to follow up on what Dr. Brewer was saying, when I was an undergrad here, I did my honors thesis on Handmaid's Tale, and this was before it was popular, right? And I don't have Hulu, so I only get to watch The Handmaid's Tale when I'm somebody's house who actually does have it. And I happened to be around the summer somewhere, and I thought, it's too close. It's too close to home, And so I think not only is this about being vigilant here in Connecticut, but I do also think that we need to talk about our obligations to students and colleagues across the country, right? And not even just across the country. I mean, think about across the world, right? I've talked to folks at institutions that their states have these trigger laws and these bans, and their life has completely changed within the past couple of months. And so thinking about how are we offering support to those folks as they're navigating those challenges. So yes, we absolutely need to be vigilant here, but I bet all of us know somebody that lives outside of Connecticut. And so what is it that we can be doing to make sure that we're being community across the country and across the world around these issues?
Can I just add one thing? I forgot to mention that everything we're doing in Connecticut can quickly go away if the wrong people are sent to Washington, D.C. I'm sure you all know that there's a lot of talk in the Congress to have a federal ban on abortions. And that majority could be our reality in just a few short months. It could be, and that would wipe out everything that we have here in Connecticut. So all the work that's been done to have the strongest laws, the federal law would supersede, would trump, well, that's probably the wrong verb to use, but would cancel out any law that we have here in Connecticut. So I hate to be so negative, but the situation really is dire. We could very easily have a federal ban, and they're not being quiet about it. They're being very plain that is a goal that many people who are running for the Congress right now and who lead certain aspects of our Congress will put in place if they gain a majority, if we no longer have the pro-reproductive rights, the pro-abortion care, the pro-choice majority that we have in Washington, D.C.
Yeah, that's really important, and kind of like, given that, what is the state legislators' role in protecting our rights, and how can our community voice our concerns and get involved in reproductive rights advocacy at the state level?
I think I answered that a little bit already, so I don't want to repeat myself, but I would say specifically to UConn students, look, when I was first welcomed on the stage, I expressed, how devastating this is, and it's the most devastating for all of you. I'm so ashamed that this country is giving you young adults your outlook moving forward as the first group of people to have a right that's been taken away, to have a civil right that was granted and then be taken away. And I'm here, my job, Representative Haddad's job, is to listen to all of you, and you've heard a little bit tonight on the things that you can do. Some of our best ideas in terms of having new laws to protect some of these things, or to advocate with the university. I've heard from a few of you already in recent months some concerns that I know have been addressed here with regard to how accessible is reproductive health care at the university. It's our job to make sure that's being that's a priority for the leadership of this university. I don't want to put it on students, but we're here to listen to all of you and whatever it is that you think we need to be advocating for. And it's our job to make sure that that this reality where you're the first group of young people in this country to have a right taken away from you, that Connecticut is doing everything it can to have that not be the reality that you have to live in.
In addition to everything that May has said, I think it's can't amplify enough the idea of using your voice, right, and using the channels that you have. And I think there's also some value in collective action, and so thinking about all of the organizations that have been doing this work for a very long time. So how are you supporting organizations like Planned Parenthood or NARAL or any of the other folks that are doing this work to be able to, again, amplify the voices of the folks that are most directly impacted, and also have the ear very often of legislators as well. And so putting your support, whatever that looks like, behind those organizations, I think also can be something that you can consider doing.
Awesome. Okay, and what can our community do, or students in general, do to ensure that reproductive and sexual health care services continue to be offered and accessible to all UConn students? And in addition to that, UConn Health, and I think that specifically like the idea of the collaboration between UConn and UConn Health.
I think that really the most important thing coming out of this is we are, as we said, building this relationship, is hearing what services you guys have on campus and what you need on campus versus off of the campus. And so we also have some state legislatures here who come with ideas, but also with money. And so that is a key word in terms of starting new services. And so what I would say is that you should use this opportunity and use this forum. You see these leaders here, and please tell us what you need, because we can say, like, we have all the services available, but it's only in this specific clinic and it's only at these specific times, which do not work for everybody. And so when we come to places that, you know, people are talking about, you know, how care has changed throughout the country. I have a lot of colleagues in all different places in the country. I trained in Louisiana. I have colleagues in Texas and also Ohio. And they are now taking care of people that are much, much sicker and in much dire straits than they would have been if Roe had not been overturned. And so sometimes when I look at my patients here in Connecticut, I am so grateful that they're here, because I know that they're going to get the highest quality care, which a lot of people, literally millions of people, are not getting in other places in the country. And so if we can start here in Connecticut and continue to show leadership and progress towards getting people good health care, and not only good health care, but just, you know, basic, some of the basic tenets of reproductive justice, which include like the ability to just live and grow in their own communities. And so that is like moving beyond abortion care. It's moving beyond reproductive health care. It's, you know, voting rights. It's also LGBTQ rights. It just can go on forever. And so looking at this panel, which I'm super excited to be on, I just want to let you guys know that from hearing what everyone has been saying, we want to help, and really the only way that we can do that and to move in the direction that works best for you guys is to have you guys tell us what you need.
And I just wanted to say, you know, on top Kara said, we're really committed to this. We want a partnership with the college. We want to help, and we want to provide the care that you guys need.
So I want to talk quickly about the idea of community organizing and thinking about, as students, how you do that organizing. So for those of you that don't know, 2022 is the 50th anniversary of the Women's Center. We're super proud of that. Kathy Fisher, our Associate Director, is here, who has been doing quite a bit of archival work. And so I want to harken back to some of the organizing that was being done 50 years ago, and what we've learned as we've talked to some of the folks who were around during that time was that they were a collective group that also had their specific interests, but they were ultimately all accountable back to each other. So it wasn't about these little pockets of organizing. It was, we're here to make sure that barriers to access at that time for women are being addressed. Now some of us are going to do that in athletics, some of us are going to do that in terms of dress codes, some of us are going to do that in terms of education for women, those kinds of things. But ultimately they were accountable back to each other. And so I think that's one thing, how as the student community, there's so many ways in which we can be so siloed around our issues. And so how are we thinking about what's the big picture? If the big picture is everybody should have the right to live their life the way they want to, then how are we in community with each other in our little pockets to make sure we're going back to that bigger agenda? I think the other thing that I would offer, and I think this may be a little bit harder to think about from the student perspective, because eventually y'all do go away. That's kind of the point, right? And for some of us, we're around for a while. How do you think about creating structures of accountability that are going to continue whatever it is you've put in place and create feedback loops with whoever needs to get that feedback, right? I've seen so often how we have, think about the responses to the protests around gender-based violence on campus, right? I know Greg and May have been around for a while for some of those, right? Not first time we were having a conversation. And so how do we learn from the task force that we had a decade ago to help inform the task force that we had this year? And so really asking you all as the organizers around that, what would accountability on an ongoing basis look like? Because that's how you can ensure that those services stay available.
And just more on a practical note, what May said about the law possibly changing and community organizing to make sure that doesn't happen and that there's a lot of advocacy around that. And then UConn Health being able to expand because of their capacity to really provide many, many services and really pivot on that. One thing just from a very practical level, if we're assuming that the law stays with access in Connecticut, is that we're trying to pay attention to a little bit of the landscape as people might be entering our state from other states that might then create different access opportunities for our own students. So we're just very practically trying to understand how the national landscape might somehow kind of impinge upon what Connecticut can offer to our students, and then work in partnership with UConn Health and the Women's Center and the state legislature to make sure that services can expand and pivot to make sure our students have that access. So it's just very practical, but we're trying to manage as much as we can where that law is going to affect how we can get our students what they need.
That's all really valuable advice, and what Ms. Holgerson said really resonated with me, because USG has a big issue with transition documents, and we have a big turnover, so it's a problem. Okay, our final question that I've prepared, and then we'll move to your guys' questions, is how does UConn support expectant and parenting students? And how will the changing environment of reproductive health care in the U.S. impact the resources dedicated to this group of people?
So full disclosure, this is a totally self-serving question. When Anya and I met to talk about this, I wanted to be able to share with you some of the work that we're doing, so thank you so much for including this question. The Women's Center convened a group of folks about a year or so ago. Tina's on the group as well, to look at the issue of supporting expectant and parenting students. And so we have representation from the Dean of Students Office, Shaw, the Women's Center, the Graduate School, some of the professional schools, other people that I'm forgetting, the Child Labs, and the Provost Office, Human Resources. So kind of all the stakeholders that would have something to say or to do about this. And so one of the first things that we did is there's now a website, studentparents.uconn.edu, and huge props to Karina over in the graduate school for putting together that website. And so what we've done is we've pulled together all of the information that expectant and parenting students might need in one kind of hub that hopefully is relatively easy to navigate. And so please do check that out, and we would welcome any feedback. And messaging should be going out very soon, both to advisors on campus as well as to the student population about the existence of that resource. But the two other things three other things that we're looking at is, one, how do we get a handle on who's actually impacted by this? You know, one of the conundrums of this has been, well, do we really know how many students are impacted by this? Well, we don't because we don't have great services, and maybe if we had services, then we'd know more from the students that needed this. Right now, we're talking about expectant and parenting, but we also know that this larger issue of students who are caregivers in general is certainly something that we need to pay more attention to, and we'll be expanding our scope. And so part of this is looking at basic data collection. How do we get the numbers so that we can also communicate with students who might need these resources at the undergraduate and at the graduate level? And I also want to mention that much of this was spearheaded by the work of the Moms for Mom group, because they were hearing from students at the undergrad and graduate level and sort of brought this forward to the Women's Center, and so we were able to put together this group. So looking at how do we create space and community for folks, how do we make sure that folks have access to affordable and accessible childcare, and then are there any sort of academic barriers that we might be able to address or massage a bit that might make life easier for those folks that are expectant and parenting students. And so that's some of the work that we're doing now. But what would be really helpful is if you could help get the word out about the website, but also begin the conversation, create the space for the students who might be kind of hanging out in the shadows a little bit around this issue, and let folks know that this is a space that we're trying to create and build more robust services for.
I just want to mention that the university has many sites that are mapped out on, I think it's the HR website, but as far as students who may need space for lactation, we happen to be one of those buildings, so if anyone ever needs to know more about that, they can look that up. There's lots of spots on campus that you can secure. We're obviously a place of an institute of higher education. The goal is to support your academic journey, so we want to mitigate any barriers that you have to. We don't want to complicate your already complicated day-to-day lives, right?
Can I ask a follow-up about that? Would a student be able to nurse their baby in class? Sorry, I don't mean to go off your script.
No, it's totally fine. It's a great one.
I'm not aware of any policy that explicitly prohibits that. Now, I think there's policy and then there's practice.
Right.
So I don't know of that. The situation has not come to our attention of when that has happened.
Yeah, no, that is a great question. I have no idea. So luckily we're running a little bit ahead of schedule, so we'll be able to get to a lot of the audience questions. And would you guys like to take like a 2-minute break and go get snacks from outside, or do you want to just jump right into questions? It only works if you answer me.
2-minute break. Yeah, 2 minutes.
Okay, 2 minutes. Snacks. Outside. questions, so keep them coming. We're going to leave this up for a little bit. So I guess we could start. Oh, yeah. Okay. So one of the questions is, what can people who are not interested in politics but are strong supporters of reproductive rights do?
How would you not be interested in politics, right? So I would go back to some of the things that I've already offered, right? Thinking about, one, who are the organizations that are either doing direct service work or are doing educational work, even if you're not interested in supporting their political work, who are the folks that are kind of on the ground in other spaces, and how can you reach out and support the work that they're doing, how amplify the information and get that out there. So I think that's one. I think the other thing is, to think about what's your sphere of influence, right? So if you're not interested in politics, what is it that you are interested in? What are the skills that you have, and who are the people that you know? And if you think about what lands at the intersection of those things with your interest in supporting reproductive justice, maybe it'll illuminate for you the kinds of things that you can be doing.
I don't want to offend the person who asked this question, but I have two pieces to a response to this question. First of all, I think that, and this is a little harsh, you have to be interested in politics. I mean, you don't have to necessarily be in politics, but if you don't see the value in politics, then you're missing an opportunity to make real change. And I would lay perhaps the reason why people feel that way at the feet of politicians and the way we run political discourse in this country. And we should have better. We should have better conversations around issues. You should have confidence in your elected representatives that they're actually listening to you, and that our system is designed so the value for politicians is to listen to you. And I think we've done some work around that here in Connecticut. So I understand why people might want to say that they're not interested in politics. But it all, at the end of the day, our rights, as we're talking about here, very distinctly around reproductive rights, but so many of our rights are directly connected to politics. And so to not be involved in politics might be an expression of incredible privilege. And so, you deserve better from our political system, don't get me wrong, and I want to hear more about that. But when it comes to these issues, politics, whether we like it or not, are going to be at the center.
And I would just add, if you're not comfortable in the political sphere, don't forget to vote.
Awesome. So our next question, I'm going to ask like 2 in 1. So how do you work to support access for healthcare for women of color in particular? And also, what ways specifically can the resources on campus be a sort of safe haven for the Black student body to feel heard about the reproductive and healthcare rights?
This is a really tough question. And I think part of it is that there has been a long historical injustice that has been done for many communities who are seeking care in general, and especially in OBGYN, gynecology, and maternity care. And, in particular, as someone that also that is trained in different places in the U.S. And then also does not identify as completely white, but being a Filipino American does put me in a more privileged group. It is something that we as a group of people in terms of like OBGYNs, and also I've worked with midwives and APRNs too, who are basically relearning and retraining how to work with people that are from different backgrounds from us, which takes a really long time, and also takes a lot of careful practice to be able to change the ways that we've been trained. As a department, we are working really hard to be able to create care spaces that are open to everyone, and we specifically have educational opportunities so that we can change our practice. In particular, in terms of being able to provide services to communities such as the Black community that was specifically mentioned in this question, being able to have clinics in different areas outside of Farmington. So we do have a clinic that opened a couple of years ago in East Hartford to provide care to the community in that area, but also in terms of the maternity care, being able to have doulas available and other services and resources that expand what we can do as clinicians to the outside community and to some of the more community groups that have really been working hard to provide care for a really long time for people in their communities, but have just not been able to have a lifeline to work with departments and also providers.
Yeah, I just want to add one more thing. There's a couple of things that we're doing as a department. Is we're actually funding students from underserved communities to come in and spend time with us, because we think it's so important to get that perspective. The other thing that I learned, I was talking to a medical student some years ago, and she was a young Black woman, and we were talking about, she said, I would never try to come to your residency program, and I said, why not? And she said, I don't see anyone there that looks like me. And it was one of those, it sounds really naive, but it was one of those things that I said, oh my goodness, you are so right. And so it's been one of the things that I've really focused on, is trying to be sure that that we have providers and we train providers that look like our patients, not just all white providers.
So again, to reiterate, because we don't provide direct services, much more of our work is in the education and advocacy realm, so I'm going to talk a little bit from that perspective. And so when we talk about the work of the Women's Center, we talk about really our goal is to be answering the question, how does gender matter, right? How does it have an impact here? And that's regardless of what your gender is, however you identify, right? There's lots of ways in which perceptions are put upon us, where we're socialized in certain ways. And we talk about doing that from an anti-racist feminist practice. And so being able to understand that when we're talking about things like reproductive justice, right, that means different things in different communities. And so we can't just be talking about the fact that abortion rights were rolled back, because for a lot of folks, reproductive justice issues were issues that were on the table that well before Roe and after Roe, right? And so thinking about things like forced sterilization, thinking about things like going back to maternal health. I read an article recently, and I'm going to forget the number, my apologies, but that Black women are something like 3 or 4 times more likely to die postpartum as a result of hemorrhaging and mental health issues, right? We need to know that. When we're looking at the data, we need to ask for and demand that the data gets disaggregated, right? So that we understand what it means for women of color, what it means for Black women, what it means for trans folks, and the intersection between trans identity and racial identity. And so, again, I feel like this goes back to what is it that we need to be learning, and how are we foregrounding the voices of the folks that are most impacted. And I'm going to push back. I hope this is a friendly amendment to the conversation today about politics. But I feel like there's big P and little p politics, right? And there's the big P, which is often like the partisanship, like the stuff that people don't like and don't want to get involved in. But like almost everything is political, right? Like when you're negotiating what movie you want to go to with your friends, like you're trying to influence them to do the thing you want them to do, right? That's sort of political. And so how are we thinking about the fact that the big P has often left a lot of folks feeling really disenfranchised? And so asking them to step into that space can feel really problematic. And so how do we acknowledge the ways in which little p is happening all over the place, and then create more invitations and more opportunities to kind of center the voices of the folks who are feeling like those other big P avenues might not be available to them?
No, I just wanted to add, so Dr. Aaron and I and Dr. Honorado are very passionate about making sure that all students feel like they belong as soon as they walk through our doors. They're welcomed, and I think that we feel like it's a bit of a privilege to be college health specialists and have the time that you deserve when you step foot into those office spaces, so that we can learn a little bit more about you and the journey that you had in healthcare before you landed with us. Maybe it's one that was of disappointment, and we can hopefully start there with your permission and make some corrections and learn a little bit more about what you need as a unique individual. We also want for our team of people, we do the very best we can to have, of course, very competent professionals working in our organization, but we know that you do look for people that look like you. And so we make as much effort as we can to find those people and create those spaces and have all of us learn as much as we can every day about your uniqueness.
Thanks. Our next question is, what advice do you have for reproductive rights advocates who are feeling discouraged by the Dobbs decision?
That says it all, doesn't it? So one, I think it's understandable for some folks to be discouraged, right? And if that's what you're feeling, that's what you're feeling. I do think, and you'll hear me talk about kind of the community organizing over and over again, but I feel like that piece of being in collective community with other folks about that is important, so that you don't feel necessarily alone in that frustration or that disappointment or that anger or that hurt. But I think this is also about giving us the opportunity to think about the future that we do want, right? Folks have heard me said over and over again, we're really good about talking about what we don't want. We're really not so good at envisioning what we do want, right? And so right now we're in this reactionary mode of this thing happened, as May said, this is the first time that folks have actually had rights taken away from them. And so we know that now. What are we going to do about that? Maybe we need a little time to grieve and heal and be in community around that. But these fights, all of these, whether it's reproductive justice or any social justice issue, right? They're long term. They are back and forths, and we still have a ton of work to do. And so figure out what's within your capacity. And I think the community piece is important because not everybody has to be full on 100% all the time. Like, you can't do that, right? And so who are our folks, who are our community that when you could be like, I gotta tap out of this one, but you got it, right? And vice versa. And so think about who are the folks that you feel like you can be in community with to do that, so that the collective work and the collective wisdom can keep you all going. And then come hang out at the Women's Center, because we're talking about this stuff all the time.
thought-provoking. It says, when does a woman's right to bodily autonomy begin? And would you support access to abortion for any and every reason, including sex-selective abortions that target female babies?
Take that easy question. So that is a very complicated question, and one of the things that I work on as I'm speaking with patients and trying to understand, how to best help them, is that line is different for every person. I'm an abortion provider, and I provide up to the state limit for abortion care, and that's for any reason. And so when I speak to patients, I always give people an opportunity to talk, because a lot of times while they might have someone in their life that supports them through a very challenging time, they might not be able to really talk about their decision making and any challenges that they have from that. I think you're bringing up specific things that are very triggering to people, such as sex selection. There are lots of other things too, and so when we're thinking about reproductive care, including abortion care, there is a real opportunity to really expand the way that we think about healthcare in general, and why people make choices, and also why people live in different ways. And so I think that there's a difference between making policies that are very broad, that do not consider all the possibilities of someone's life and what can happen, and then also being in a room with a patient who is making a very personal decision. As someone that provides abortions, that provides really devastating miscarriage care too, and just talks to people about their lives and what they want out of it, and how I can help them every day. I think that that it is most harmful to take those types of decisions and that opportunity to have that communication with someone, like a really open communication, to take that away, to satisfy like a broader, more black and white picture of how people should live their lives.
Okay, our next question is, how can students get involved in helping peers get support for sexual trauma? And what are the volunteer opportunities, and are there paid opportunities?
So I would first encourage the students to call Student Health and Wellness if they have undergone sexual trauma or any trauma. And what we would do is we start with providing information about the advocate that the student could talk with, what it means when you're beginning the conversation of disclosure, so who you share the information with and what happens with that information. So really important to have the time and take the time as you have the conversation with the student about what it is that they would like to do as we proceed through all of the resources that are available. But from a medical care standpoint, we're always there to talk to the student as they decide what happens next. If there is the we meet the criteria for the student who chooses to have a safe exam, and that can happen right on our campus. We make those arrangements, and we provide many other resources, people that are at this table and others during the immediate time following the report, as well as however long after that the student wishes to engage in any kind of services. So follow-up, initial care, follow-up care, linking students to resources with our Dean of Students office, public safety if they wish, mental health, as well as anything that would be in the community that they may go to after they leave this one. So there's resources that will continue to be available to our students.
I thought that I heard that there was a peer aspect to that question as well, right? And so, as far as I know, there aren't any paid opportunities on campus for peer advocate support. The one thing that the Women's Center does offer is our Empower support group. So the facilitators of that group are actually paid facilitators, and they're students. And one of the things that I think is important about that group is that came from survivors asking for space to be in community with other survivors. That was actually an internship project that somebody had done while they were at the Women's Center, and we were able to vet that through the university so that it was about survivors, students who are survivors being in community with each other. So I think Empower is one of those spaces where peers can be supportive of other peers. Similar to what Tina was talking about, so all of the sexual assault crisis services throughout Connecticut, I believe all of them have volunteer opportunities for their crisis hotlines, and some of the other programs that they offer, and so that's a volunteer opportunity. I believe there's like a 40-hour training that you have to go through to be able to work the hotline, but again, remember that those community-based resources are often used by students, not only students at UConn, but also if you've talked to students at other institutions, you know, we have a wealth of resources here at UConn that many other institutions don't actually have, and so students are in other colleges and universities are heavily relying on those campus advocates and those hotlines, so volunteering for those programs are an option as well.
A little bit separate, but more about prevention. So if you're interested in trying to prevent sexual assault or help students who might be put in situations where that might happen, there's, through the Dean of Students office, there's also Protect Your Pack, which offers volunteer opportunities to be a peer about that, as well as through the Sexpert program, which talks about healthy relationships and how to recognize when you might not be in a healthy relationship. So more about prevention, but also great volunteer opportunities to, you know, work at different components of the situation.
Reminded me, thank you for that. One, similar to the Dean of Students office, we also have a violence against women prevention program. We do workshops in the first year experience classes. But the other thing that reminded me, back to the peer question, one of the things that we talk about in the prevention workshops is about normalizing these conversations, right? We sort of assume that the only time that we are talking with survivors is when they've officially come forward and are seeking resources and services, and the reality is based on the statistics we are in the company with survivors all the time, right? And so how do we create space for those conversations to be conversations that are okay to have with anybody here on campus? And I understand why that can feel scary and confusing and, you know, kind of make people uncomfortable, but folks are navigating all kinds of trauma on our campuses all the time, right? And so how are we thinking about just a trauma-informed approach in general, which means we sort of assume that folks are struggling with some sort of trauma and that we are able to sit with them in that and let them know that we are here to support them, whether it's in a paid position, a volunteer position, or like, hey, I happen to sit next to you in class and now we're talking about this.
And I think there's also some times a misperception that if you call us, then you have to go through the entire process, or there's a mandatory reporting to police. And if that's what you wish to do, then that's what we would help support you with, but that's not true, right? So those are choices that you have, and there's also not a time limit. So sometimes people will not know what they should do, and maybe they have a friend who encourages them, and we are fine if that's who you want to bring with you, but it's never too late to call us so that we can help.
I was just going to add that I do think, to add to Kathleen's earlier point, that I think there are a few sexual violence advocacy organizations that have a few new paid internship opportunities as part of, a broader equity effort with regard to internships. So we can look into that. And also, Connecticut has some of the strongest laws in the country with regard to sexual assault, and particularly sexual assault on college campuses. And I've been privileged as a state senator here at UConn to work with Representative Haddad to make sure that that is the case. It's one of the most important things I've had the chance to work on, and I think it's one of the most important jobs I have as the state senator for this university and two other colleges. And that work happened because of the advocacy of UConn students. So that, I don't think that can be understated enough. There have been and there are today tremendous advocates on this campus who have been that peer, who have been the one helping their friend and said, something at this university doesn't work and it's been fixed because of that student advocacy. Or something at this university didn't work and there should be a law to fix it, and that law is now on the books because those students came forward and told their stories, and it wouldn't take no for an answer.
Thank you. Yeah, everybody's looking for internships now, so that's great. What are ways that money can be funneled towards candidates that are in strong support of women's rights? And I think this is specifically for political candidates or for the government.
So that's an interesting question. So I referenced a little bit earlier in my slightly controversial response about being involved in politics that I think in Connecticut we're trying to have systems in place that can give people more confidence in our political system. So this question provides me with an opportunity to expand on that. In Connecticut, for all state offices, state representative, state senator, secretary of state, the governor, the lieutenant governor, we have a system of public financing. It's called the Citizens Election Program. And most candidates participate in this program. And so it's designed to take money out of politics. So when I run my campaign, or when Greg Haddad runs his campaign, what we do is we go out to people who live in our district and we ask them for contributions, small contributions, and in my case I need 300 people who live in our Senate district to contribute to the campaign, and I have to raise about $17,000. And then I get a matching grant from the state to run my campaign. When you participate in the program, you agree to the spending limit, and frankly the likelihood that your opponent is going to have exactly the same amount of money as you. I think that's really changed how the state legislature works. I've only ever served in the state legislature when this system has been in place, and I think it makes it so everyday people have a bigger say in what their state rep or their state senator does, or any of the Connecticut state offices that people hold. And so I just reference that because, if a group of people who are organized around these issues were to, to come forward and want to participate in a campaign, that would be the way to do it. It also takes a lot of, what you see on the national level, right? It used to be the opposite on the national level, where money is a real focus for federal candidates, and there's all sorts of outside spending that still is an issue. Even with our public financing system, there can be opportunities for outside groups to spend money on behalf or in opposition to a candidate, and so that is a way that specific reproductive rights, abortion rights groups are involved in our political system right now. I know both NAROB and Planned Parenthood have separate arms of their organizations where donations to their political work go specifically in the advocacy for individual candidates or against.
Another question is, how is UConn able to support out-of-state students, especially during breaks, especially those who may live in abortion-restricted states?
Well, one simple resource that we have is that on our website there is access to national resources that might be of support. Also, if students can come back into the state, we're open, we are available to support students to get access to reproductive services throughout the entire year. But I know this gets to the health equity issue of where some students don't have those kinds of resources to travel at will. But the resources on the website will help get them perhaps to a closer location, and others on this panel can talk more about ways in which access is available across state lines.
I talk a little bit about that as I know a lot of providers nationally, and there are great community organizations that are working on the ground all over the U.S. So there are a couple of different national websites that have kind of like just pooled all of this information together. And so one of them is ineedna.com, and there's also the National Abortion Fund too. And so a lot of these places have their own funding opportunities. So even if you are in a state that does not provide full reproductive health care, or you have like other questions about that, these are places that you can get knowledge from. I know that there's a lot of fear about what you Google and everything like that, but at this time I think that people are starting to learn different ways to access the internet that is not with websites that do not share information as much, and so you can even look into that before you're leaving the state, but there are a lot of national opportunities to get resources and to get care throughout the U.S.
And I'll just add, that's something I've heard a lot of concern about from the students, and actually next week at Representative Haddad's initiative, we're meeting with the administration of the university to talk about several issues, and that is one of them. And so I'm curious to hear both from the students in the audience and the members of the panel more feedback about that, because if there needs to be an emphasis on the resources that are necessary to make sure that no student at UConn, no matter what time of year it is, if we need to make sure they get access to whatever healthcare they want, we need to make sure that that happens. And I'll just add that the university is a huge organization and it is a bureaucracy, and so sometimes one of the things I really enjoy about being the senator here at UConn is that Representative Haddad and I can sort of cut through that bureaucracy sometimes, and systems that might be a little bit slow. The university is very sensitive to questions that come from legislators, because to Kara's point from earlier, we do control the money that comes from the state to the university as well, and so it's our unique job to exert that influence on your behalf.
That's awesome. Yeah, I know that I was talking to Kathleen about this the other day, that a lot of times it's like just red tape that prevents people from doing what they actually want to do, so that's awesome. We'll do maybe one or two more questions, and then we're coming to the end of our time pretty soon. So somebody asked, how do we know who we should vote for and put into Congress? It's scary to think about candidates lying, but I want to ensure we're choosing people who will fight for our rights.
It seems a little self-serving for me to answer this question. You can look to some of the abortion rights groups that we've talked about here this evening. They, as I mentioned, they make endorsements And you know, our district here, as I mentioned, in terms of the state legislature, is a really important district. And I'm endorsed by Planned Parenthood, just to be really clear. And you can see, you know, at all levels, which candidates are endorsed and which ones have taken the pledges to not just uphold rights to abortion, but all of these issues that we've been talking about here this evening in terms of equity in our healthcare system. And so you can look to those organizations to see, you know, who's running for Congress and which organizations they've endorsed. And I'll just say that in some ways, the most important vote a legislator, so a member of Congress or a member of the state legislature can make, is that vote they take at the beginning when they're sworn in, which is who the leader of the United States Senate, the U.S. House of Representatives, or the state House and the state Senate. And some candidates here in Connecticut may be saying that they're pro-choice, that they're for abortion rights and reproductive health care, but the person they're going to vote to be the leader of our country in the U.S. House or the U.S. Senate is not. And so those candidates, in my opinion, are incredibly dangerous. So be careful about that as well.
Okay, I think we are nearing 8 o'clock at this point. So I don't think we have more time for questions. However, I strongly encourage all of you to continue this conversation beyond this event and think about how you can get involved in reproductive rights advocacy, hopefully through one of the many ways we talked about tonight. And one avenue is through USG, which holds its sexual health subcommittee meetings on Wednesdays at 5 p.m. in the SOC conference room, and all undergrads are welcome. And if you don't know where that is, it's on the second floor, if you're walking past the Dunkin', go up the little steps. And again, I would like to emphasize that, as we've talked about extensively, reproductive rights are being stripped away from millions of people, and historically marginalized groups are once again being disproportionately affected. And through our discussion tonight, it's clear that we need to support these groups here at UConn and through our other avenues. And we hope that students' voices will be heard on this topic so we can improve services and potentially even maybe have abortion available on our campus, which has been seen done in other states. And it's clear that although the services being offered are extremely useful and important, more work needs to be done. So I'd like to sincerely thank all of you for attending this town hall, and your questions were super insightful, very thought-provoking. If you have any remaining questions or comments, please feel free to come up. And I don't know, some people might have a time constraint, but I can be here. We can chat. If you want to get in touch with USG and the work that we're doing, or any of the amazing resources that are linked in the pamphlets. And finally, I'd like to thank all of our speakers for coming out. Thank you so much for being here and dedicating your time to our students and our community. The work you do is really important, so thank you. And I believe that's all the time we have tonight, so I will end it here. Thank you.